Hi everyone, I'm joined by Joel Raymond, a Cognitive Behavioural Hypnotherapist, and by our clinic manager, Verity Anderson. And we had a fortuitous experience where we were at a meeting and Verity mentioned that she was having difficulty with pulling out her hair, which is medically known as trichotillomania and can be a sign of stress. And Joel decided that he would give her a session. So this is post-session. I'm just going to have a little bit of a chat to show you all how hypnotherapy can be a very effective, quick treatment to help you, for example, amongst other things, with bad habits. So Joel, can you tell us, about that day that you met and how you decided to treat Verity and what you did?
So habit reversal, behaviour change is actually quite a straightforward process. Obviously for people suffering from it, it can be quite traumatic and they might not know how they can possibly change their behaviour. So I asked Verity if she'd like to do a short session where we work on her issue, and we had very successful results. So Verity, perhaps you'd like to tell us a little bit about your initial problem.
So when I was anxious or at times of stress, I found that I just sit and pull my hair out, and sometimes a lot of time would go by. But I did notice that even though it could be at times of anxiety and stress when I'm busy, it would always happen when I'm not doing anything else. So I wouldn't stop to do it, but I'd get easily distracted by it.
So in Cognitive Behavioural Hypnotherapy, we use a CBT approach to make the client aware of the components of their habit. So I asked Verity about her physical behaviour, but also about her thoughts, the thoughts associated with the habit, and also her emotions, her feelings. So once we've established the negative components of her habit, we then choose completely opposite set of behaviours which we're going to help Verity choose consciously over her negative set. And this process of being aware of the old habit and switching to a new habit is a very quick and effective way to overcome any bad habits and behaviours. So Verity, we made you aware of your old behaviours and we chose a set of positive behaviours. How did that affect you, those changes? How quickly did that help you?
So whenever I'd be sitting down and I'd go to pull out my hair, what I went through with Joel to do was to just take my hands away from my hair, sit upright, and just sort of say to myself, I want nice hair. And obviously pulling it out is completely counteractive to that. So after a while, I just wasn't going to do it anymore. So now I'm fine. I'm just amazed at how one session has got me so far.
And how long do you think it took from that initial awareness of the bad habit to actually stopping it completely?
I'd say for a good week I was still going for my hair quite a lot, but then it was sort of a slightly slower process for maybe like 2, 3, 4 weeks, and then now I don't do it anymore. So
and during that time, you still going through the same process with yourself, reminding yourself of the new positive habits? Especially
at the beginning, but then later on I didn't say as much to myself about wanting nice hair. I just stopped doing it, and that was enough.
That's great. And so you can see, it's not a magical, I snap my fingers, you wake up from hypnotherapy and you're fixed. But with practice of new positive behaviours, the behaviour change can change very quickly. Just a few weeks you can change a behaviour that's been a problem for years.
Okay, thanks for sharing your story. I'm glad that Verity was able to get help really quickly, it seems like, from hypnotherapy. I just wanted to ask you, Joel, because I'm not a hypnotherapist, I'm a psychiatrist, as you know, what can hypnotherapy do for people out there? What kind of things can you treat?
So there's a range of conditions that I'm comfortable treating. This ranges from anxiety, stress, mild depression, phobias, smoking cessation, and also panic disorder, which can be very traumatic for people, but can also be dealt with quite efficiently and effectively.
Great, so basically most mental health conditions you can work with them, and how many sessions might it take to get someone over their problem?
Well, habit reversal, as you saw, was quite quick, although
that was one session, people can really get better in one session.
They can get better in one session, but it still requires continuous work from the client after the session using the homework we've discussed. And this is very important with cognitive behavioural hypnotherapy, is the more effort and work the client puts in between sessions, the quicker they get better. But for most issues, I would say around 6 sessions should be able to give a client enough information to work on their problem at home and really start to get it under control.
And cure it.
Of course, it depends on the severity and how long the problem has gone. But yes, I really believe that clients, if they put the effort in and they work on their problem in between sessions, that they can really cure themselves.
Great.